Blood-Borne Pathogen Exposure Control Plan. Purpose. This program has been developed in accordance with OSHA Blood-Borne Pathogen Standards 29 CFR 1910.1030. The purpose of this exposure control plan is to eliminate or minimize occupational exposure of employees to blood or other potentially infectious materials and to comply with applicable standards. Employees involved in construction are not normally exposed to blood and other potentially infectious fluids and materials, and it is not reasonably anticipated that any employee will be exposed to such materials except in a first aid accident. However, OSHA does require a construction employer to comply with the following regulation. In the absence of infirmary, clinic, hospital, or physician that is reasonably accessible in terms of time and distance to worksite, a person who has a valid first aid certificate must be available at the worksite to render first aid. OSHA has interpreted reasonably accessible in terms of time and distance as 3 to 5 minutes from the time an employee is injured. Few contractors are able to meet the requirements of this standard and are obligated to appoint an on-site first aid provider. Although OSHA's blood-borne pathogen standard does not apply to the construction industry, employees given first aid responsibilities will be afforded protection under this program. Program activities. Determination of exposure. This exposure control plan is specifically for the remediation engineering employees trained in first aid and/or CPR. We have determined that the identified first aid trained employees may be expected to incur occupational exposure to blood or other potentially infectious materials. The exposure determination is made without regard to their use of personal protective equipment. Any employee who voluntarily renders first aid while at work will also have the right to be covered by this plan. Worker practice controls. Construction activities do not lend themselves to engineering controls for employee protection. Therefore, work practice controls in the form of universal precautions will be used to eliminate or minimize exposure to employees. The following work practice controls will be followed. 1. Wearing the proper personal protection equipment. 2. Performing first aid procedures as best as possible to minimize the possibility of splashing, spraying, and splattering of blood or other potentially infectious materials. 3. Removing soiled PPE as soon as possible. 4. Cleaning and disinfecting all equipment and work surfaces potentially contaminated with blood or other potentially infectious materials. Note: a fresh solution of 1/4 cup chlorine bleach per gallon of water can be used as a disinfectant. 5. Through hand washing with soap and water immediately after providing care and after handling soiled or contaminated equipment. Antiseptic towelettes or hand cleanser will be made available where hand washing facilities are not accessible. Eating, drinking, smoking, applying cosmetics, and handling contact lenses are prohibited in work areas while exposure to infectious materials may occur. Use of leak-proof labeled garbage bags as containers for contaminated waste or laundry. Minimize potential exposure through accident prevention, employee safety training, and proper use of personal protective equipment. The only sharps that may be present on the worksite would be from an insulin-dependent employee who self-administers the injection. The diabetic employee will manage their own diabetic sharps and place them in the appropriate sharp container that they will provide. The above controls will be examined and maintained on a regular schedule. Hand washing facilities provided with soap and water are available to employees who have exposure to blood or other potentially infectious materials. In the corporate facility, hand washing can occur at any sink in the shops or the restroom. For the field operations, hand washing will take place with the water supply provided by portable containers. If water is not readily available in the field, the first aid kits will contain antiseptic hand cleaners with paper towels or antiseptic and towelettes. The foreman should make sure that employees wash their hands and any other contaminated skin immediately after removing personal protective gloves or as soon as feasible with soap and water. The foreman should also ensure that if an employee's skin or mucous membranes become contaminated with blood or other potentially infectious materials, the area is washed or flushed with water as soon as feasible following contact. Potentially exposed employees shall not eat, drink, apply cosmetics or lip balm, smoke, or handle contact lenses. Personal protective equipment. All personal protective equipment used is provided without cost to employees. PPE is chosen based on the anticipated exposure to blood or other potentially infectious materials. The protective equipment is considered appropriate only if it does not permit blood or other potentially infectious materials to pass through or reach the employee's clothing, skin, eyes, mouth, or other mucous membranes under normal conditions of use, and for the duration of time while the protective equipment will be used. The employee's foreman shall ensure that employees shall use appropriate PPE. If an employee fails to use proper PPE, circumstances shall be investigated and documented in order to determine whether changes to the exposure control plan can be implemented to prevent such occurrences in the future. Plaas Incorporated makes sure that the appropriate PPE is in the appropriate sizes, is readily accessible at the work site, or issued without cost to employees. Located at each first aid station adjacent or included with the first aid kits will be disposable blood-borne pathogen kits. Mouth-to-mouth resuscitation, CPR. Resuscitation shall be conducted with a mouthpiece. Mouth-to-mouth resuscitation without a mouthpiece is not permitted. The following procedures shall be used in performing CPR. If feasible, single-use gloves should be worn and disposed of properly. One-way valve masks should be used and then destroyed. All responders must be trained in the use of the mask to ensure the proper face seal and maintain an open airway. If an ambu bag is used, it must be cleaned with a diluted bleach solution after use. The airway should either be disposed or cleaned thoroughly with a diluted bleach solution. Gloves should be worn for mouth sweep procedures to dislodge any material from the victim's airway. Spill cleanup. The following procedures should be followed for the cleanup, removal of blood or other materials that may have occurred at the emergency site. A freshly mixed solution of household bleach and water should be prepared in a 1 to 10 dilution, 1 cup bleach, 9 cups water. The spill area should be flooded with the solution allowed to soak in the area for 10 to 15 minutes. This makes the contents non-infectious. The solution may be soaked up, mopped up in a routine cleaning manner, and sewered. The person cleaning the area must wear gloves. Shoe covering is needed for large spill amounts. Gloves are to be removed and disposed of properly upon completion and hands washed with soap and water. Hepatitis B Vaccination Program. Plaas Incorporated offers the Hepatitis B Vaccine and Vaccination Series to all identified employees who may incur occupational exposure to blood-borne pathogens and post-exposure follow-up to employees who have had an exposure incident. All medical evaluations and procedures, including the Hepatitis B Vaccine and Vaccination Series and post-exposure follow-up, including prophylaxis, are made available at no cost to the employee. Made available to the employee at a reasonable time and place. Performed by or under the supervision of a licensed physician or by or under the supervision of another licensed healthcare professional. Provided according to the recommendations of the U.S. Public Health Service. An accredited laboratory at no cost to the employer conducts all laboratory tests. The hepatitis B vaccination is made available after an employee has been trained in occupational exposure within 10 working days of initial assignment and completion of first aid training. To all employees who have occupational exposure, unless a given employee has previously received the complete hepatitis B vaccination series, antibody testing has revealed that the employee is immune or the vaccine is contraindicated for medical reasons. Participation in a pre-screening program is not a prerequisite for receiving hepatitis B vaccination. If the employee initially declines hepatitis B vaccination, but at a later date, while still covered under the standard, decides to accept the vaccination will be made available. All employees who decline the hepatitis B vaccination offered must sign the OSHA-required waiver indicating their refusal. If the U.S. Public Health Service recommends a routine booster dose of hepatitis B vaccine at a future date, such booster doses will be made available. Post-exposure evaluation and follow-up. All exposure incidents will be reported, investigated, and documented. When the employee is exposed to blood or OPIM, the incident should be reported to the manager of safety or foreman. When an employee is exposed, he or she will receive a confidential medical evaluation and follow-up indicating at least the following elements. Documentation of the route of exposure and the exposure circumstances. Identification and documentation of the source individual. Unless it can be established, the identification is infeasible or prohibited by state or local law. State or local laws affecting the investigation or documentation of exposure incidents are N.A. The source individual's blood shall be tested as soon as feasible and after consent is obtained in order to determine HBV and HIV infectivity. If consent is not obtained, the manager of safety establishes that legally required consent cannot be obtained. When law does not require the source individual's consent, the source individual's blood, if available, will be tested and the results documented. When the source individual is already known to be infected with HBV or HIV, testing for the source individual's known HBV or HIV status need not be repeated. Results of the source individual's testing are made available to the exposed employee, and the employee is informed of applicable laws and regulations concerning disclosure of the identity and infectious status of the source individual. Collection and testing of blood for HBV and HIV serological status will comply with the following. The exposed employee's blood is collected as soon as possible and tested after consent is obtained. The employee will be offered the option of having their blood collected for testing of the employee's HIV/HBV serological status. The blood sample shall be preserved for up to 90 days to allow the employee to decide if the blood should be tested for HIV serological status. All employees who incur an exposure incident will be offered post-exposure evaluation and follow-up according to the OSHA standard. All post-exposure follow-up will be performed by a qualified healthcare professional at the closest medical facility to the incident. The healthcare professional responsible for the employee's hepatitis B vaccination is provided with the following: a copy of 29 CFR 1910-1030, a written description of the exposed employee's duties as they relate to the exposure incident, written documentation of the route of exposure and circumstances under which the exposure occurred, results of the source individual's blood testing if available, all medical records relevant to the appropriate treatment of the employees involved, including vaccination status. Plaas Incorporated will obtain and provide the employee with a copy of the evaluating healthcare professional's written opinion within 15 days of the completion of the evaluation. The healthcare professional's written opinion for HBV vaccination must be limited to whether HBV vaccination is indicated for an employee, and if the employee has received such vaccination. The healthcare professional's written opinion for post-exposure follow-up is limited to the following information: a statement that the employee has been informed of the results of the evaluation, statements that the employee has been told about any medical conditions resulting from exposure to blood or OPIM which require further evaluation or treatment. Note, all other findings or diagnoses shall remain confidential and will not be included in the written report. Biohazard labels are affixed to containers of regulated waste, refrigerators, and freezers containing blood or OPIM, or other containers used to store, transport, or ship blood or OPIM. The universal biohazard symbol is used. The label is fluorescent orange and orange-red. Red bags or containers may be substituted for labels. Blood products have been released for transfusion or other clinical use are exempted from these labeling requirements.